Traumatic brain injury, or TBI, is often caused by a sudden hit to the head. According to the Centers for Disease Control and Prevention, TBI is a major cause of death and disability in the United States. About 166 Americans die from TBI-related injuries every day. The Leon S. Peters Rehabilitation Center helps patients who suffer from a TBI live their lives to the fullest after their injury.
The different types of treatments that are available for traumatic brain injury can consist of physical therapy, can consist of occupational therapy, and speech therapy.
Rebecca Iniguez is one of many physical therapists at the Leon S. Peters Rehabilitation Center. She works with patients who have suffered from TBI.
Traumatic brain injury can be graded based on it being a mild injury, a moderate injury, or severe injury. The types of brain injury, depending on the severity of the injury, classifies where they're graded.
TBI can happen to anyone, from a car accident, playing in close contact sports, or even from a fall.
It can cause bleeding, bruising, hemorrhaging, or a skull fracture.
Speech-language pathologist Kendall Kalsevich says there are certain age groups at higher risk of suffering from a TBI, like babies and toddlers, seniors, and this group.
Are young adults and adolescents, so anywhere from 15 to 24, and that group is at high risk because unfortunately our brains aren't quite fully developed until we're 25.
Kendall helps patients with communication and swallowing issues. She works alongside her colleague Rebecca to offer patients the best and most comprehensive care.
Many brain injured patients have to learn to walk again, they need to learn to talk again, how to eat, how to help themselves, dress themselves, and so they often need the whole rehabilitation team, which includes occupational therapists, speech-language pathologists, and physical therapists to regain those normal functions that they learned before.
Rebecca says the recovery process following a TBI can be challenging, and progression varies for each patient.
Sometimes, depending on the severity, a person may not be aware that they might be experiencing some changes, something as mild as some balance issues or vision issues since their injury. So it's important to have the appropriate diagnosis so the person can receive the appropriate treatment.
Both Rebecca and Kendall agree that having support from family and friends during the recovery process is important for long-term healing. They also say you can take preventative measures to reduce your risk of a TBI, especially in your own home.
Ensuring that the area is cluttered free. If there is small throw rugs, rolling them up and having them removed from the home. Ensuring that if you need to ambulate or walk with assistance, that you have that assistance.
If you or a loved one has sustained or you think has sustained a brain injury, you should get immediate emergency services and be evaluated by a provider because it can be a life-threatening condition.
Some signs and symptoms of a traumatic brain injury may include headache, loss of or decreased consciousness, loss of memory, changes in vision or speech, disorientation, or difficulty concentrating.